Hi, I'm Dr. Bill Beauchamp. I'm an orthopedic surgeon and I work here at Highpoint Orthopedic Associates. I come to Gallatin from the Middle Tennessee area in general. I grew up on a farm in northern Michigan, and when I got done there, I went to Michigan State University and trained there. Went to Detroit and did my residency. Afterward, I spent some time in the Army and did orthopedic trauma surgery, which I really enjoyed doing, taking care of soldiers, which kind of brought me back to Middle Tennessee. I've worked in the area for the last 22 years, and at this point in my life, I had found a great opportunity here at Highpoint, and the opportunity to try and continue to take care of the people of Middle Tennessee. This community has such a great mixture of people that are both from the rural community to the urban to the suburban. And so I see a little bit of everything. And I like to bring my skill set into the skill sets of and lives of all these people that I run into every day. I get asked all the time, why did I become an orthopedic surgeon? And the reasoning may be a bit crazy, but my brother and I are both physicians, and neither of our parents are in medicine. In fact, nobody else in our family was. Growing up, I grew up on a dairy farm, and we went through the time of muscle wasting disease in the cows. And one of the things my father would never do is give up on his animals. And so every morning I would have to go out there before school, and we put the cows up in winches and we try and work their muscles and try and get them to work and to walk and to just live. When I got into school, I really thought a lot about those things, and I spent some months in my second and third year of high school working in the ERs on weekends, just transporting patients, oftentimes catching myself following the orthopedic surgeons around, watching them get people moving, following the physical therapists, seeing what they could do. So when I got into medical school, I did my training and I came out and I really found myself drawn back to that desire to get people up, get them moving, get them able to do such things. It's amazing now how technology has come since the time I got out of training. Things with robotics, things with new technologies, new implants, new approaches have really advanced the cause of orthopedic surgery to where people can walk and do things, use their upper and lower extremities in ways that we never thought they'd be able to after injuries or even just after the normal effects of life and age. You know, why did I choose to come here? I could tell you it's because the technology upstairs is equal to any place there is, and the skills of the surgeons I've met here were incredible in developing and growing. I could tell you because the nursing staff and the other people I met were obviously very professional and good at what they did. I could tell the administrators were on top of things, making sure they had the best hospitals community. But I'll tell you what it was. When I walked in the hospital that day to walk back to admin, I walked by 5 people between the front door and that. And every one of them, whether they were a nurse, an administrator, and support staff, or even people that were volunteers, everyone said, "Good morning, how are you?" I've never forgotten that from the day I came here. When you come to see us in the office and I introduce myself to you, I want to make it clear to you that I care about what's going on. It's important to me that we identify what your specific issue is, then also talk about the things that support you in your journey to try and get better with that. There's a lot of things, family issues, ability to get to the office, but then also an understanding of what particular technologies we use. It's important to me that I want to share your x-rays with you, I want to share your labs with you, your studies with you. I want to help you understand what it is we can do to help you, what we propose to do to help, so that at the end, it's really important to me that you care as much about it as I do, that you know that I care enough to take care of you and the family that you support in getting better, getting healthy, getting right. But at the same time, I'm going to help you care more about what's going on in your life with the things that you brought to us. And if we haven't done that right, I want you to tell me so. I love to be involved with the community, and that doesn't just mean at the hospital. What's going on? I want to know, because I think it helps me to understand everything that people bring in. But I also involve my family. I have 15 grandkids. I have 5 children, and I have a wonderful family support system. Probably one of my favorite supports is my dog Zoe. She's crazy, and we wrestle every day, or I am told I'm supposed to. I also am a huge Michigan State fan. I went to school there, go Spartans, but I love my Predators. I will live and die with them, and I just look forward to the day that we can carry the cup home. Really enjoy this time to get to talk to you. Hope you get to talk to you in person sometime, but have a great day, and know we're here for you if you need us.